This week's injury update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.
Dr. Crenshaw, thanks for joining us from JOI, specializes in hips and knees. And while we've got ourselves a big knee injury in the NFL this week, obviously the Nick Chubb injury from Monday, it seemingly is about as devastating as it comes, Doctor.
Absolutely. Not the thing you want to see, both as a spectator and as a team, seeing that kind of injury.
This is a guy that had an injury back in 2015 to the same knee, and it was really one of those that's like everything, ACL, MCL, I think PCL, all the medical terms. Does it put the knee at risk for suffering it again, or 8 years later is this potentially just a circumstantial thing?
Well, I think based on his history, it's fairly circumstantial. He's played for several years, numerous years after he had his multi-ligament reconstruction, and came back from what some people would have projected as not being able to return. So I think that speaks for itself. This injury was, more of just an unusual mechanism, and just the right set of circumstances creating a bad injury. So I don't think the previous surgery is relevant to the injury as much as it is to the treatment, because right now you get into a situation where the previous treatment now affects the present options, whether it's where you get grafts from or where you place these things to try to reconstruct this knee, at least to get him back to at least some level of activity, and whether or not he can come back to the same level of performance he did before and wants to in the future is really uncertain.
I understand that you wouldn't know like all the specifics of this particular case, but just generally speaking, when you have these significant injuries to the knee, which several of them can be significant, we can deem the levels of significance. But this one obviously looked just awful. Is there a time when is it a week later, a month later, 6 months later that he would be able to get back on the field?
Well, I think so much of that is depending on the circumstances of how he's treated and what he actually has. Obviously, the injury was consistent with multi-ligament and essentially a type of knee dislocation, and they'll prioritize that. I mean, the first thing they do is make sure he doesn't have any neurovascular injury, and once they've cleared through that, then typically you allow these a period of cool down, and then you get an assessment based on imaging and kind of trying to figure out, strategizing what to do in what order, whether you do things all at once or whether you do them in a stage fashion. Really depends upon the circumstances, the surgeon, and the players.
Dr. Steve Crenshaw from Jacksonville Orthopedic Institute here on ESPN 690. Brent and Friends. Dr. Crenshaw is a Jacksonville native, graduate of Emory University, and the team physician for the Jags and Jacksonville University as well. So he's been around this stuff quite a bit. I was thinking of it from a I don't know, like a wear and tear standpoint or a flexibility standpoint. How much can the knee take? Because obviously these are running backs, and this is a sport that's violent and takes a lot of hits to begin with. Is it one of those parts of the body that can actually take a pretty good beating, but sometimes it takes too much?
Well, I think you just described the natural history of an NFL football player. I mean, especially the running backs and some of the other positions where they're taking hits and having to put a lot of stress on that knee. Most of them have a fairly short career because of that relative to some of the other positions. And, most of these players do retire with some level of arthritic disease, which is the end product of all these injuries. And this type of injury would be no different. I think many lesser injuries still have the same end point, which is they become arthritic and end up having to give up their career, in part because they can't achieve the level of performance they did before. And some of it, they just, it's a pain and tolerance issue. So, it's different for everybody. And there's some classic examples of people who've made it back after surgeries and bad injuries. But, the list is short of people who've come back from this type of multi-ligament injury.
You specialize in hip replacement as well. And it got me thinking during the break, actually, when we were going to have you on, I said to Casey, it doesn't seem like that's a common thing in football, maybe even some other sports anymore from a hip standpoint that we see in the headlines. And it got me thinking back to like Bo Jackson, right? I mean, his career ends because of, I believe, a degenerative hip. that Casey brought up, Tua obviously had a significant hip injury at Alabama. But do we see it more frequently than I'm noting in sports in general? Or is it usually something when you get a little bit older, or you might have to deal with older when you played sports earlier?
Well, hip injuries occur. Probably the most common hip injury in the active athlete are soft tissue injuries, whether it's high hamstring or adductors or core injuries, as we would call them around the sports hernia world. But the actual articular injuries which occur, and they do. I mean, there have been some cases of people who had hip dislocations and hip fractures that require treatment, and those are all occurrences that can damage the joint, and over time that joint becomes arthritic, much like the knee. I would agree that the hip is less common of an injury and less common of a problem to deal with in their active playing years. It's probably one of the more common things they deal with as the years go on. And many of them do go on and need to have their hips replaced because of the wear and tear that occurred over their professional career.
Dr. Steve Crenshaw with us from JOI. Just a last question for me. How many of the injuries that these guys suffer, especially on the football field, these guys are tough dudes, are pain tolerance type things where, you'll hear it all the time where people will say, or the coaches will say, hey, everybody's playing with something, right? Everybody's playing with something, and yet they still play. So I got to believe that's a fine line between if it's not structural or you can't damage it even more, or if it's a sprain or whatever it might be. Pain tolerance really comes into play for these guys, right?
Oh, absolutely. And I think that's probably some of the times the biggest deterrent to treating these players or protecting them is they're very dedicated and committed to getting back on the field, and they've lived with pain as most of us know throughout their career before their professional career is just dealing with hard workouts and even minor injuries, but the pain is there. So there aren't many players that are out there that are not pain tolerant, and the level of pain tolerance really defines when they go back to play and how well they do.
I can see Dr. Stephen Crenshaw in the San Marco offices. Hopefully you don't have to see him for anything significant, but if you have to, go look him up, Dr. Stephen Crenshaw from Jacksonville Orthopedic Institute. Doc, appreciate you joining us for a few minutes. Have a great day.
All right. Thanks, Brent. Have a good one.